Hey guys, and welcome back to SSR TV. I'm Lauren Klump, and on SSR TV, we talk to real doctors about topics and issues affecting your health and wellness. Today, we're talking about a really hot topic. It's almost impossible that you have not heard the name Martin Shkreli by now. Martin Shkreli is the pharmaceutical CEO who raised the price of one life-saving drug over 5,000%. This resulted in the cost of just one pill being at $750. This, of course, has gotten a lot of media attention, and it's raised a lot of questions for patients and consumers about the state of the American healthcare system and what might we expect next from big pharma companies. So today, I've got two great guests, and they're going to break it down for us. Dr. Jay Greenstein is the founder and CEO of Sport and Spine Rehab Companies, and Dr. Barton Bishop is the Chief Clinical Officer at Sport and Spine Rehab. So they're going to break it down for us, guys. Let's go. All right. So, gentlemen, the Martin Shkreli case has caused a lot of fear through the media, and we're getting a lot of conflicting information. From your opinion as a doctor, what is it that patients and consumers really should know?
Well, Martin Shkreli has become this poster boy of corporate greed, specifically big pharma corporate greed. It's one thing, though, really important to know is that Martin Shkreli does not represent all of big pharma or all of corporations. He's obviously, an interesting feller that is doing some interesting things. The bigger problem, though, that people need to recognize is where pharmaceuticals have inserted themselves or have become inserted into the delivery of medicine and the state of medicine in the United States, which is that for a wide variety of conditions, something like toxoplasmosis, where it's absolutely the first line of defense to other things, but for a wide variety of conditions, pharmaceuticals have become the first line of treatment. And it's kind of sad that we as Americans have really allowed this to happen. We go to Whole Foods and we spend $30 on organic free-range chicken because we want to make sure that the chicken has friends and has room to roam, and we think that's better for us and it's healthier for us, but you know what, we're going to go ahead and take some pharmaceuticals and some drugs instead of doing a more natural, healthier, drug-free alternative that might just take a little bit more time or a little bit more personal devotion to that treatment.
Yeah, I agree with that. I think there's a real challenge because we're inundated with so much content as it relates to the pharmaceuticals that are out there. And one example that we had talked about this week was on the Super Bowl. In the Super Bowl, one of the commercials was a drug that dealt with the side effects, constipation, of opioid use. So you're taking a drug to deal with a symptom of another drug when there's other alternatives out there. And I think the challenge that we face as Americans is that we are, according to one report, we're the 37th healthiest country in the world, yet our healthcare system is the most expensive. So there's something wrong in which our health is being managed. And I think for us to improve our conditions, our health-related conditions, we've got to make conscious decisions to really do what we know works best. It's about good eating, it's about appropriate diet, it's about stress management, it's about managing our musculoskeletal systems appropriately and not just addressing symptoms. It's about making sure that we get enough sleep. All of these components tie into us living healthier lives. So I say this a lot. Health doesn't necessarily come from a pill. Health comes from a lifestyle.
Mm-hmm. Yeah, the only thing we're worse at in the world in the United States is math, probably, than health. Be clear, toxoplasmosis, the treatment for the drug in question from Turin Pharmaceuticals and Shkreli, that's something that requires a drug. I mean, that's something that there really aren't other alternatives to treat this parasite. But there are so many conditions that we go to primarily. You mentioned musculoskeletal health, and that's our specialty is musculoskeletal health. And you talk about, I think my number one is headaches. What does everyone think of when they get a headache? They think of Tylenol, Aleve, Advil, aspirin. I mean, over-the-counter, seemingly innocuous, not going to kill you, not going to be addictive drugs. But there is a lot of research now that is showing that just one dose of an anti-inflammatory like Advil or ibuprofen can substantially increase your risk to have a stroke. Just one dose, and you know, people just aren't aware of this. You know, there's only 2 nations in the world that allow television advertising for pharmaceuticals. It's the United States and New Zealand. Everywhere else, there is no advertisement. So people aren't as inundated, whether it's in the Super Bowl where 115 million people or whatever watch the Super Bowl, and they're inundated with a drug to treat a symptom of a drug. The next drug that's going to come out is, you know what, you're going to the bathroom too much, so now you're going to have a drug to slow down that flow for the drug that you're taking, to speed up the flow for the drug that you're taking to reduce your chronic pain, when you could just see a chiropractor or a physical therapist or a great conservative neuromuscular specialist to resolve your chronic pain, to manage your chronic pain, to provide you with, to empower you with the tools necessary to treat yourself, instead of taking the drug for, you know, either it's the easy way out or it's just you don't know any different because you haven't been introduced to different.
And I think you definitely hit that nail on the head. People don't know any different because they haven't been introduced to anything different. So what would your advice be for action steps? Say a patient gets a diagnosis. What should they next do, whether it's get a second opinion or just see what their options as alternative to drugs might be?
So, you know, chronic pain is a $300 billion problem in this country, and the way that pain is being managed is not working. And Dr. Barton mentioned it earlier, you know, there are side effects in taking these drugs. So for patients who are sitting in front of their physician and the physician just wants to pull out the prescription pad and write a prescription, I think there's really 2 or 3 questions that are critical. One is, what is the evidence to support this intervention? What do I know about the outcomes related to this particular intervention for my condition? Secondarily, what are the side effects? What side effects are potentially involved with this particular intervention? And then lastly, what are the functional approaches, and I'm talking specifically about patients who present with any pain-related condition, what are the functional approaches that actually will resolve this problem instead of taking a drug or a chemical that truly cannot fix a mechanical disorder of the musculoskeletal system? So again, it's what's the evidence, what are the side effects, what's the functional approach? And I think if you ask those questions, if patients out there are asking those questions, they're going to come away with more options that tie to their value system. And again, we're in this era of value-based healthcare, and it's all about patient-centered care. It's not about the doctor telling the patient this is what you need. It's about the patient asking the right questions, identifying those interventions with their core values, and then taking the best approach in which they feel the most comfortable.
Yeah, you're spot on. The other thing I wouldn't do first is I wouldn't Google your condition, because you probably have cancer. Because anything you have, from itchy skin to whatever, it's cancer. Okay, let's just face it. So it's probably not cancer. But Dr. J's spot on in those 3 things. And there are other conditions besides musculoskeletal conditions that also can be managed functionally. And that includes diet and exercise. And I know people don't like to hear about that. And diet gets a bad rap. It's not about going on a diet. It is modifying your diet. It is changing your diet. There are foods that are known to be stimulants of the inflammatory response. If you have pain, if you have chronic pain, you don't want that inflammatory response to go through the roof. You want to calm it down. There are things that you can eat, modifications in what you eat in order to calm that down. It's simple stuff. The inflammatory response is not just chronic pain. It's also heart disease and cholesterol. Cholesterol is the thing that helps to heal our arteries when they get injured. It's an inflammatory response in the artery. Look, this is not to bash pharmaceuticals. This is not to bash big pharma. This is to help people understand that there are other options. They may not be as easy as popping a pill or taking a drug once or twice or 3 times a day, but my God, they're better for you. And they are going to make such a dramatic impact on the quality of your life for the long haul that if you see the forest for the trees, you're just going to be such a happier and healthier person at the end of it.
Well, I just want to thank both of you so much for the real talk and explaining this to us. You've illuminated a big issue that affects all of our lives, and you've told us how we can be empowered to ask those questions and really take our health into our own hands. So thank you, Dr. J, Dr. Bishop. It's very much appreciated.
You're welcome.
Thanks, guys. Great to see you.
Guys, thanks again for joining us today. Be sure to leave your questions and comments below, and please do subscribe if this is your first time here for weekly videos on health and happiness. Thanks, and have a fantastic day.
Bye, everybody.
Bye, everybody.